I've seen all of these terms used to describe tendonitis in the shoulder. How do these differ, and what codes would you choose? And that's the list of the different ones that they had. So I went and did a little research for it. Okay, the difference between tendonitis and tendinitis or tenosis is actually pretty interesting. So that is something you need to know first off. Tendonitis and tendinitis are two separate things. And really, why does it matter? Well, because tendonitis is usually an acute injury. That's going to change the way you code, right? Tendonitis. And tendinitis is usually something, or tenosis is failed healing or repetitive trauma. So this is a great graphic that I found. That shows you here's the Achilles tendon that goes up the back of the leg. Now, of course, I'm showing this is the only graphic. I couldn't find one on the shoulder, so I'm using one that is a tendon there in the leg. So right there, that Achilles tendon. If you have tendinitis, it's an inflammation of that Achilles tendon. All right. If you have tendon rupture, the tear of that, that's another diagnosis. But tendinosis is like little tiny tears in there on that. It hasn't ruptured, tore completely. It could still be inflamed, but tendinosis is different. So once you understand the difference between tendinitis, tendinosis, that will help you with your coding. Now, RCT is rotator cuff tendinitis or tendonitis, and that is in the shoulder, the rotator cuff. So again, we need to be aware of the difference there. Where do we need to go find the codes? Well, here's some codes that have to do with shoulder lesions. And that's actually what this is, a lesion in the shoulder. And so I pulled this off of Find a Code. You end up being under M60 through M79, but we want to deal with shoulder lesions. And here is kind of a catch-all of the ones and the options that you have. They tend to be M75 codes, and you have all of these, this rotator tear or cuff, and or rupture. Then this one, calcific, has to do with a buildup of calcium deposits and stuff. Bursitis is an inflammation, but we're probably the one that they had mentioned. Other shoulder lesions or shoulder lesion unspecified is what most likely we're looking at. The key, though, in understanding the difference between these specific ones is the acute and chronic would mean, sudden onset or pain that's been around for a little while, chronic shoulder condition. But note that chronic does not have a time limit. So he could have happened last week, and with anything in the any kind of trauma or injury or inflammation, any diagnosis, and the doctor states that it's chronic, then it's chronic because the provider gets to state. But if it's a sudden onset, then that's the definition of acute. Okay. And since we don't practice medicine, we can't say whether, this tendinitis is normally something that resolves itself in a week or not. And if this person has it for 2 weeks, does that constitute it being chronic or not? The provider gets to tell you that. But a rotator cuff tendonitis is specific. It's a specific injury to that the rotator cuff itself. So very simply put, understand if it's tendinitis or tendonitis or tenosis, what's the difference, and that little description there of the each one's an inflammation, one's, you could have a actual, no matter where it's at on whatever joint that you're looking at. So again, that's a really quick answer. The codes themselves are going to be listed via the site. Where is it located at? So the rotator cuff, the shoulder one, these are the codes that you're looking at, these M75 most likely, to find your code. Short and simple and sweet.
Do you need more medical certification and business training? Learn more at www.cco.us.